works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Air Tamer Personal Air Purifier. It's easy to have filtered air with an Air Tamer Personal Air Purifier. An Air Tamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Air Tamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Air Tamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code AgelessHealth and get a 10% discount. Order today.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Dr. Tom Roselle here, and this is Ageless Health live stream. A little bit of a technical difficulty today, but we seem to be getting it through. So we're going to make it happen and try to walk you through. If you notice, I'm all dressed up and looking like I'm going to go to a party. Well, they won't let me in. Why? Because it's Women's Day at the Roselle Center in Fairfax, Virginia. And it's just one of those things. They says no boys allowed, no men. And you got to be straight up, got to be double X. Otherwise, they're not letting you through the door. It's really a beautiful day. We put this together. Dareth Painter, Sybil McFarland, Connie Curran, even Sue's there, and they're putting together a great day. It started at 11 o'clock. They're going to go till about 3 o'clock this afternoon. So if you're in the neighborhood, stop by. If you're in the Fairfax, Virginia area, we're on the third floor on 8500 Executive Park Avenue, and really join it. Again, they've got me locked in, so I can't show my face because, I've got this kind of stuff going on. I'm the guy, so it's all for you ladies. It's beautiful out there. It's absolutely gorgeous. I mean, they've got flowers, and they have flower essences, and they have thermography demonstrations and acupuncture, and they have these beautiful handmade cards and other things that, ladies, you'll enjoy. One of the things that they're going to be looking at is Lotus Way fluorescences. Those will be there. Dareth will be there to explain them to you. It's really fun. They enlisted me this morning to be able to do some of the things I need to get done to help them. But after I did that, they said, "Okay, bye, see you. You got to go now." And I said, "Okay, fine, I'm out of here." Anyway, drop by if you can. We're going to talk a little bit about your hips today as we're leading into a program at the Roselle Center coming up. I think it is the 14th of August. It'll be right here and on a Wednesday evening at 6 p.m. I'm going to be co-presenting with Dr. Harlan Browning, who we lovingly call the professor. Most of you that have heard Dr. Browning speak before know this guy's brilliant. He's going to give you more data in a short period of time and totally understandable. But please make sure that you register for the class because, as you know, sometimes they're overwhelming, meaning we don't have enough seats for everybody. You're going to be sitting in the hallway. But join us. And if you like to do it the old-fashioned way, that's real simple, too. 703-698-7117. You can make it happen that way. And if you can't make it, something comes up, which, life is life. All you got to do is give us a jingle. Call. Say, hey, I can't make it happen. Want to talk to you a little bit about your hips today and some of the things that you can do to help yourself. When you talk about low back pain or low back mechanical disruption, you can't leave the hip out simply because that is the balancing act for everything that's above it. And we're getting more and more people that are having degenerative disease of the hips. They're breaking down where they shouldn't break down. And so the question becomes, why is that? What happens that causes the hip mechanically not to work? Well, first, let's take a look and see what you look like. If you're standing upright, you should be able to have somebody put their hands on your pelvis and they should be even. They should line up perfectly. If they can't do that, if you're like this, you're lopsided, that means one part of your pelvis, your low back and so forth, mechanically are going to be distorted, and you're not going to be able to get that easy glide movement. And if you're a golfer, guess what? You're shanking that ball on a regular basis. So if you're a tennis player, there's no way that because you can't extend your leg, you're not going to be able to move one way or the other laterally as gently and easy as you'd like to without pain. So what do you start doing? You start loading up with NSAIDs and naproxen and all kinds of other things, and then you go to the steroids. So let me tell you something about steroids. We talked a little bit about it in the radio program just before we get on the air with the Ageless Health live stream. Steroids, as I've told patients for years, will cause the joint space to break down. Now suddenly, out of the blue, you have guys coming out of Harvard, and these studies come up and say what we're noticing is people who have had steroid injections into their hips increase the rate of osteoarthritic degeneration. That doesn't sound so good, does it? It means that you're going to break down faster. A steroid knocks out the inflammation that may be causing pain. And if the pain is coming from the inflammation, that's why the steroid all of a sudden works miraculously. But it doesn't fix anything unless it's simply a bump and compression on the little synovial membrane that you have in between the joint space. It's called a bursa. And if that's the case, then if you quit doing the things that you were doing to irritate it, once you knock the inflammation out, it might feel better and stay that way, providing that you do other things. But in today's world, how many of us look in the mirror and we say, there's a little bit too much poundage on us, that it's not working the way it's supposed to? I don't know about you, but when I look at people, and I've been in practice for over 4 decades, people don't look the same as they used to look so many years ago. It's just not the way it's supposed to be. So if that's the case, if we're putting poundage on and we've got to carry that around and there's no strength in the core, don't you think the same thing would happen to you as happens to your house if you overload the floor? I would think so. I would think that is going to be problematic, and it truly is. And we get the wear and tear, we get breakdown. But there's one piece I want to bring up. We've talked about it once before. And when it comes particularly to hip pain and lack of function, if you're sitting there right now and you're at home, lie on your side and see if you can lift your leg up laterally. And particularly the one we're talking about is the one that hurts you, right? See if you can lift it up laterally without it making you hurt even more. Now, what could be the problem, and I'm going to show you how to get it done and identify this as a home diagnostic thing. Not perfect, but it's going to show you. When you're in that position, open your mouth and just hold it there. Don't bring it back, just in a neutral position. Just drag it down while you're laying on your side. Keep your head straight, so put a pillow so it keeps it like this, not all the way up, not all the way down, just kind of neutral. And then lift your leg up again, or have somebody lift it up for you. If it goes up more easily, it tells you that there's a muscle in the back of your jaw called the pterygoid that is too tight. And that can happen because of bad, I'm going to just say it straight up, bad dentistry. It can happen because you chew gum all the time on one side of your mouth. It can happen because you got in a fight once and you got clocked into the side of the face and it's never been right since, any of those things, or simply you're a grinder. You clench your teeth like this, and that will lock up the hip. And then over a period of time, you're feeling more and more breakdown, more degeneration. Now, on the 14th of August at 6 p.m. at the Roselle Center for Healing in Fairfax, when you come in, I'm going to demonstrate that. And I'm going to show you what it looks like when, one, it's there, but two, I'm going to free it up on somebody. It's going to be a patient, somebody that I know that's part of our office clan here. And I'm going to show you the motion that is immediately returned. Now, here's the problem. If that is locked in tight, you're going to rub and grind and break down, and over a period of time, you're going to have a bad hip. It's just going to happen. If you sit on the floor and you do kind of bicycle pumps with your legs like this, and you hear pop, pop, click, click, guess what's happening? You're wearing that joint space down, and sooner or later it's going to be a problem. Now, you compound that, and you have a viral infection inside that joint, and it gets activated simply because of the irritation or blow or trauma. You're going to have it break down even faster. So you've got to treat it in a way that sustains the balance. If you end up with a sacroiliatus, that means your sacrum, that wedge-shaped bone that sits at the base of your spine. I'm going to show it to you right now. I've brought a demo. We're having a little problems with our video, but here's your spine. And when we're talking about the hip, we're talking about this fossa with the leg going into it here on both sides. You got two of them, right? And it goes in here. The sacrum is this wedge-shaped bone at the base of the spine that supports everything else. But if the hips are not working the way they're supposed to, then this tilts and your spine does this. If it goes backwards, so you're trying to get rid of pressure on it, then the spine's going to straighten like this to try to keep you upright. So what happens is all these nerves that come out from the spine that go into your hips and your pelvis and your organ systems and your legs and your feet are going to be irritated. They're going to either be overstretched or what? They're going to be compressed. And so subsequently, you're going to have what's called pain. It's going to be loss of function, and you're going to continue the process of breaking down over a period of time. So understand that when this mechanically is not working the way it's supposed to, because one, you may be not wearing good shoes and it's going to distort it. If you're wearing high heels, ladies, if you're wearing high heels, here's what happens. You're pushing up on the spine, right? And you're doing this. You're going to move forward on the pelvis. Now, your body can't walk around that way, so you move your body back, and the back muscles, all these muscles back here, are going to tighten, they're going to contract, and these are going to overstretch. They're going to be out of balance, more pressure on the pelvic girdle, more pressure on the hip, and now things worsen rapidly over a period of time. You know, we used to kid around, and I think I've mentioned it on the radio program before, is that the chiropractic profession has an agreement with the shoemakers. And what the agreement is that as long as they keep making heels that are unbalanced and force that spine forward, you know, our business goes up. So what we do is we donate to the retirement fund as a thank you. Now, I'm teasing, obviously, but think about that, right? It continues. You can't get better if the mechanics of your body are abnormal. It's impossible. It's not going to work. Now, if you wear a platform, different story, but those heels, those 2, 3, 4 inch spikes that you put on and that force your body forward and arch your back backwards, you're going to have a problem. It's just the way it is. There's no way that it can't be. Now, it can be pain, or it could be all of a sudden with your hips, you're going to get pain in the groin. It's going to be inside. So where's the groin, you say to me? So the groin is right in through here in the front part of the pelvis. Here's the leg. It goes in like this. So it's going to be right in this area. It's going to radiate down into the leg. It may radiate into the vaginal cavity. It may radiate into the testicular area. Now, here's the other thing. You see these nerves that come back here? These nerves that come off here, they go down the legs. But you know where they also go? They go to the scrotum. they go to the testicles, they go to the vaginal vault, they go to the ovaries, and so forth. So if the nerves are being irritated simply because of the mechanical platform is not correct, do you think there's a possibility that maybe that your mechanics, guys, your hydraulic system, if you will, using that term, are going to be problematic, not be able to work? You might experience what, ED? You have no sensation, you can't feel anything, you can't get stimulated. I don't know about you, but that's what the literature says. And but you got to dig again. If it doesn't fit Fifth Avenue marketing, you might not hear it that way because it's not about what? It's not about Viagra. It's not about, these other things that cause nitric oxide elevation. There's a lot of guys that have really good nitric oxide, but they still have problems with erectile dysfunction. Why? It can be that whole low back and hip mechanism. I had a patient many years ago. He's a truck driver, long haul truck driver from New York to California. And I was treating him one day, and he had a wallet that he had taken out of his pocket. And that wallet was about that thick. I mean, it was ridiculous. So I was kidding him. I said, "Hey," I said, "do you have that in your pants all the time in your back pocket?" And he laughed. He said, "Yeah, it's my filing cabinet." He said, I have to keep that with me. It's everything that I need." I said, "Do me a favor." I said, "Your adjustments have been making you better, but they're not holding the way they should. Promise me something." He said, "When you get in the truck, take that out and either put it in, where you can grab it real quickly, but don't sit on it anymore." He just looked at me. I said, "Promise me." And do that for about a week's time. And he said, "Okay." So he came back in. He had a long haul. He was actually going out to Chicago that week and came back. And so when we saw him, he said, "Doc," he said, "I don't have the discomfort and travel that I used to have." I said, "That's what you've been doing, silly man." I said, "You've been sitting on the problem." And he looked at me. And so about 2, 3 weeks later, we're getting a lot of stability in his pelvis. He's doing well, got him on some exercises and so forth. He said quietly, he said, "Hey," he said, "nobody can hear me, right?" I said, "Yeah, we're in the treatment room and the door's closed." He said, "I never mentioned to you that I've had some problems with, sexual arousal." He says, "I couldn't feel much." I said, "Why didn't you say something to begin with?" And he said, "It seems to be getting better." He said, "Could that have been the problem?" I said, "Yeah, it could very well have been the problem. You're sitting on the compression." But it's the same thing with sensitivity in the vaginal vault, any sharp shooting pain, any rectal pain, sharp, like almost like a stake up the back of your butt and sit you up real quick like that. And then all of a sudden it relaxes and it goes away. That can be that low back, pelvis, and hip irritation. So if you experience that even occasionally, that's not normal. And we got to find out what it is and make sure that we fix those pieces of abnormality. And I use the term abnormality because that's really what it is. It's not normal to have that type of experience. So on the 14th, when you come in, I'm going to show you different presentations. Dr. Browning is going to show you what happens. And he knows that, man. He goes through the anatomy. He'll connect it for you. He does it in a very simple way. When you leave, you will know, and we'll be able to give you things that you can do at home to make a difference. But seriously, do this. Take a look at your legs, okay? The upper part of your legs. If you used to have hair on your legs and your hair's not there anymore, it's because the circulatory pattern from the spine, not the blood vessels, the neurological flow from the spine is not working as it should. So nothing can grow there. And so subsequently, if it affects that, it's going to affect other things as well. Wouldn't it be cool if you could do certain things to get rid of that and get back to where you need to? Wouldn't it be great if all of a sudden your golf game gets better simply because of the fact now you have more flexibility, motion, rotation in your hips and your low back? Well, that's what we're going to talk about. So from your jaw, that pterygoid muscle that we talked about, right? The positioning, the alignment of the pelvis, even to the point where you have an anatomically short leg. How about if you have a bow leg? A bowing of the leg. You can have one or you can have two. I have a slight one. Thank you, Grandma. and passed it through. But I've known that for a while and been able to make sure that I can maintain normal function and strength. And I played ball in college and all those kind of things. But how many of you don't know that you might have the problem? How many of you, say, I can't figure out why everybody else can and I can't? Or that your pelvis is turned, it's rotated. So your pelvis should be level, not twisted, one form or the other. And as I showed you on my friend here, so we're looking at a pelvis straight out. Here's the hips, right? That's what we call the hips. It's actually called the iliac crest. And then here are the bones of the spine. The low back is called the lumbar spine. What happens if you have a slight rotation like this, just a little bit of a turn? First, you're going to get a lot of torque, irritation in the low back, but also you're going to get an abnormal irritation in the pelvic structure called the hip. Okay, this is called the acetabulum, and then the femur, the head of the leg, goes in there. So this area's got a cartilage in it, and that abnormal wear and tear inside here now causes degeneration. And if you add that to lack of calcium, and this becomes degenerative and osteoporotic more rapidly, guess what's going to happen? You're going to break something. And when you break it, now you're looking at prosthesis. Now you're looking at total hips. Now you're looking at having to do things that could have been avoided a long time ago. So here's a couple exercises for you to do, right? They're real simple. If you're lying flat on your back in bed, face up. Now, all I want you to do, real simply, you can start at one leg at a time. Force your knee down with your leg straight, but force your knee down on the bed. You're going to flatten it out. And then as you flatten it out, then I want you to tighten your buttocks muscles. You're going to tighten those glutes out. You're going to hold it for about 8, 9, 10 seconds. And when you get used to doing that, you say to me, well, how many should I do? Over the day, I want you to do about 30 of them. But by the way, don't let them, with the other side kind of feel neglected. Do the same thing there so you get good pelvic balance. That's the first thing that you need to do. When you're seated in a chair, just sitting down, bring your knees together tightly. And you can get a ball of socks or a towel, a hand towel, make it about that thick, and put it between your knees and squeeze your knees against that ball of socks or that little towel that you put in there. And that'll strengthen the adductors, right? If you're standing up, stand straight, get next to the wall and put your foot right next to the wall and push with a straight leg against the wall. Just gently. You're not going to move it. I just want you to tighten the muscles. And then turn around and do the same thing on the opposite side and tighten the muscles. Little things like that will help you maintain some decent tensile strength. I don't know. Did you hear me say go to the gym? No, I don't want you to go to the gym. And then I want you to walk. I want you to get outside and I want you to walk just a little bit. 5 minutes one way, 5 minutes the other way. Every day, same time, same walk. 5 minutes, 5 minutes. Then add a minute, now you got 6 minutes, 6 minutes. Do that over maybe a week and two. Then add another minute and so forth. Get yourself up to where you're walking maybe 20 minutes, 10 minutes out, 10 minutes back. I didn't say fast. I said just walk. Now, the other piece of the puzzle, right, is what? Get that paid for belly lower than it is now. And many of you can do it simply by eating properly. I didn't say cut things out. I just said add things too, like proteins and tons of vegetables. Use a little bit of sweet potato, wild rice. Get rid of the creamy crap that you put on it and the fried foods and so forth. And then if you got to cheat periodically, you got to cheat. Now, as a patient, I'm going to tell you something else that, the things that you need to do. But start with that. Make a difference. And I promise you, that just doing little things make huge difference. But join us on the 14th of August, 6 p.m. at the Roselle Center for Healing in Fairfax. And we're going to have some fun. We're going to show you things you can do to protect yourself, to get your pelvis back. You know, if you don't have good hips, if you don't have good low back, if you don't have a good pelvic basin structure, strength, you're going to be sitting. And I don't think that's what you want for your life, do you? Well, we're going to give you more to do, and we're going to show you the little things like the vitamin D and the magnesium levels and how they need to be balanced, why they should be that way, what happens if you don't. Those of you who are drinking sodas by, I was going to say a case, but yeah, a lot of you do. You know, you get the big ones like this. The phosphoric acid is pulling the calcium out of your low back and out of your joints and out of your hips, and you're going to break something, my friends. You're going to break something. We're going to show you how to beat that. We're going to show you some substitutions. Join us on the 14th. You're really going to enjoy the process. We're going to have a lot of fun, as we always do. You know me, I can't get my mouth shut sometimes, but join us there. And don't forget, when you have the opportunity, go into drtomroselle.com, go into the Ageless Health Store. Got a lot of stuff in there that I think you might be interested in that are designed to help you help yourself. So check it out. The live stream is there, all the rebroadcasts that we have, the podcast from the radio program. We do this ongoingly for one reason only, to give you everything that you need to live a better, healthy life, an ageless health life. I'll see you next week. Remember, I do this ongoing simply because I love you all. Have a great Sunday.
you.